Hello, my name is Katie, and I am a nurse educator. When you have high blood pressure, it is important to know some of the problems that can arise and how to solve them. Did you know that high blood pressure that is untreated could lead to a stroke? The brain needs a constant supply of blood to work. During a stroke, blood stops flowing to part of the brain. The affected area of the brain then becomes damaged. Most strokes are caused by either a blockage in a blood vessel, which supplies the oxygen and nutrients to the brain, or a vessel in the brain that ruptures. A stroke is a very serious medical problem that is life-threatening and requires quick medical attention. It is important to recognize the symptoms of a stroke and take immediate action. The symptoms of a stroke include weakness. You may feel a sudden weakness, tingling, or loss of feeling on one side of your face or body. Another symptom includes visual problems. You may have sudden double vision or trouble seeing in one or both of your eyes. Speech problems can also occur. You may have sudden trouble talking, slurred speech, or problems understanding others. During a stroke, you may experience some movement problems. These include things like trouble walking, feeling dizzy, a feeling of spinning, a loss of balance, feeling like you're falling, or blackouts. The acronym FAST is an easy way to remember the signs of a stroke. When you see these signs, call 911 fast. F stands for face drooping. One side of the face is drooping or numb. When a person smiles, the smile is uneven. A stands for arm weakness. One arm is weak or numb. When a person lifts both arms at the same time, one arm may drift downward. S stands for speech difficulty. You may notice slurred speech or trouble speaking. The person can't repeat a simple sentence correctly when asked. T stands for time to call 911. If someone shows any of these symptoms, even if they go away, call 911 right away. Make a note of the time the symptoms first appeared. Remember, the quicker you get medical attention, the sooner treatment can begin. Another serious problem that can arise from untreated blood pressure is a hypertensive emergency. A hypertensive emergency is when your blood pressure is dangerously high, causing harm to the organs in your body. The top number or systolic reading is 180 or higher, and the bottom number or diastolic reading is 120 or higher. Along with your high blood pressure, you will also have symptoms that mean your organs in your body are being harmed. This severe blood pressure can cause damage to your heart, kidneys, brain, eyes, blood vessels, and other organs. Some of the symptoms of a hypertensive emergency include chest pain or shortness of breath, seizure with no history of seizure disorder, back pain, moderate to severe headache, weakness in the muscles of your face, arms, or legs, trouble speaking, extreme drowsiness or confusion, restlessness or anxiety, fainting or dizziness, change in vision, or nausea and vomiting. If you have these symptoms and your blood pressure is 180 over 120 or higher, call 911 right away. Do not wait for your blood pressure to go down on its own. You need immediate medical attention. When you have hypertension, it is important to learn the signs and symptoms of medical emergencies, but it's also important to learn how to manage your blood pressure when you are feeling sick. If you have a cold or cough and you are taking over-the-counter medications, you need to be careful that you are not taking a medication that could raise your blood pressure. Cough and cold medicines with decongestants, such as pseudoephedrine or ephedrine, can increase your blood pressure. Make sure you talk with your doctor or pharmacist before taking any over-the-counter medications. If you are experiencing vomiting, diarrhea, fever, or profuse sweating, call your healthcare provider. You could be at risk for dehydration. Some of the medications you take, like diuretics, may need to be held during this time. Do not stop or start any medications without the approval of your healthcare provider. It is important that you continue to get routine checkups, even when you are feeling well. You should also monitor your blood pressure at home, eat a heart-healthy diet, and stay active in order to keep your blood pressure in good control. We have learned a lot today about problems that can arise when you have hypertension and when to seek medical care. Let's take a second to check our knowledge. What is the acronym for remembering the signs of a stroke? Great job! It is FAST, F-A-S-T. True or false? If you suspect someone is having a stroke, it is okay to wait a little while before calling 911 to see if they get better. That's right. It is false. Always call 911 immediately if you suspect a stroke. What blood pressure reading indicates a hypertensive emergency? Very good. If the reading is 180 over 120 or higher, that is a hypertensive emergency. True or false? If you are not feeling well and have a cold, it is okay to take any over-the-counter medications because they have no effect on your blood pressure. Very good. That is false. True or false? It is always a good idea to talk with your doctor or pharmacist before taking any over-the-counter medications. Very good. That is true. Your doctor or pharmacist can advise you on the best options. Great job! I hope that you learned a lot about some of the serious problems that can arise when you have hypertension. Knowing the symptoms of a stroke and hypertensive emergency, as well as how to manage your blood pressure when you are sick, will help you quickly identify when you or someone else needs immediate medical attention.